Welcome everyone. This is a webinar that's going to be on active travel and the benefits of active travel for health. But we're going to try and really get underneath the skin of this, is trying to understand where we've gone from and where we're going to. So perhaps I'll give a little bit of an introduction to start with. The first thing is that what we used to do is talk about active travel as journeys and steps and physical activity. And of course, that is really important. We create more physical activity, which we know is good for us. But I think as movement and we've come forward, we're talking a lot more about how we create health and create the conditions for health in communities. And that's not so much the journeys, it's about the community being outdoors, connecting to each other, the walkability, the whole essence of trying to build a place where activity outdoors, whether it's journeys or other things, are all part of creating a health. And then when we talk about that, actually active travel is creating its own health. And I'll just talk about that in a sec before I hand over to the amazing panel. And therefore, we know about physical activity, we know about the steps, we know about that, but there's a lot more about what active travel do combined a community together and that walkability. I'll just touch on a bit of research because I always feel, because I'm chairing this, I can actually do this bit. But what we're now realizing is that we have a constrained amount of energy. So when you have chronic stress, you're living in a deprived area, you've got poor relationships, you're feeling unsafe, you're feeling anxious, that uses up energy in the body. And what we now know is that energy is taken away from the repair of cells and the way that we actually heal ourselves. So if someone lives in chronic stress for years and years and years, they won't heal, they won't repair, and therefore their body becomes sicker. And that's right down to the cellular level. That is really important in the fact that we now know that reducing that chronic stress is so important. So creating the conditions where people feel safe, valued, and belong is one of the new kind of ways of doing it. And active travel fits in perfectly with that. But it also means we're creating health in its own right, as opposed to purely just saving money from the NHS, which of course is important. And I'm sure we'll be talking about that as well. So welcome everyone. Thanks very much for coming. We've got a really good set of people we're going to be talking to, and we've got a good crowd already of over 100 who are listening. I've got on the board here, the panel, Chris Boardman, no introduction needed really, Commissioner at Active Travel England, Chair of Sport England, gold medalist, all-round hero. But what really gets me about Chris is, Chris, you are personally engaged with this. You're personally driving us forward, and the amount of energy you put in is just phenomenal. And I think that is where the difference is being made, and it's being seen not just in Sport England, but also in Active Travel England. So I think everyone around and listening to this would want to give you a massive thank you for taking this forward. But I'm always just amazed how much energy you're putting into this and belief in it. Catherine Woodhead, Living Streets Chief Exec. Catherine, you've got an incredible past of all sorts of charitable um, positions, all senior, and you've come to Living Streets, giving it a brand new strategy, a fresh look, a real energy in it. And I think this is where we're starting to see active travel and communities and walkability all coming together and that equity which you're doing. Ansaf, well, Ansaf, you're my Director of Public Health because I live in Oxfordshire. So thank you very much for protecting us all during the heat the other day. But you are, again, someone who's been driving forward lots of innovation. You're on the board of the Association of Directors of Public Health as well. So you've got that national role. But in Oxfordshire, huge numbers of things with Sport England, active partnerships, the work you've been doing on that and active travel is really fantastic, which is why we're so lucky to have you. And Daniel Bullaway, thank you very much for coming. You'll come up Edinburgh at the moment, and you are going to tell us how you're doing it in Scotland. What's going on in Scotland, where there's always been this great ambition of active travel, and we're hoping that is still there, and you're still doing that. So we're going to give the team, we don't quite know how many minutes, but what we're trying to do is give you enough time to speak at the end and have questions. So put the questions in the Q&A right from the start, because I might kind of pick and choose some of them and push them back to the panelists during that time. But I'm going to get Chris to talk about where Active Travel England is going, Catherine, then Ansaf, and then Daniel. and then throw your questions in. We'll have a little bit of a panel discussion at the end of that, and then we'll come to your questions. And we obviously have to finish on the dot of 1 o'clock. Just before we start, I just want to just sort of say some of the work that I kind of feel we've been doing as well in Beat Street, because that is where I've been learning about this whole shift from the steps and physical activity to community. And I think when we try and make through the game people feeling safe, valued, and belong, even without any infrastructure changes, we can shift. So last year we got 113,000 people. 57% of those adults were walking more from active travel, 64% of children, 17% increasing their cycling. And we know this is sustained for up to a couple of years, and car trips down by 20%. That's not because we're clever in dealing with how do we actually make the place, the infrastructure. It's because we're getting thousands of people out, all doing the same thing. They feel safe. They feel they're valued because they're doing a game, but they feel they belong to a movement. And that's what we're trying to really do to shift the culture. And we will continue to do that. And thank you always for the support from Sport England. Chris, do you want to just tell us what Active Travel in England are doing? You had a great launch the other day and it looks exciting. Tell us more.
Thank you, William. I did, and I'm going to try and batter through my words. A lot of people who've seen me over the last week will have heard some of this because I've been on the soapbox pretty much non-stop, but it is an exciting time. I'm not sure if anyone at the moment is or has just tuned into Andy's speech that everybody was waiting for. I haven't. Topically, I was actually getting some exercise in the last hour, but I have absolutely every confidence that our words align because, as you alluded to, William, he's kind of the reason I'm sitting here. We both believe in practical health and probably more specifically creating the conditions for it. Few things as possible, do them well. And the reason for doing that is because if we get it right, the strategy that you alluded to, we'll have nearly 4.5 million fewer sick days every year. So there's your growth. We'll have almost 2 million freed up GP appointments. So there's your NHS support. It will allow households to save up to £1,700 because they're not compelled to have a second car, prevent 2,500 premature deaths. And all of that rolled together is an economic boost of 115 billion. So there's the stats. And I think if I told you that I had a product that could deliver those outcomes, you'd be expecting a pretty meaty investment over many, many years. And that's the exciting thing about this. To get that to happen, we need 5.3 million more people to be active. What needs to be true to get that outcome is they have to have easy access to health, which is why we're all sort of here on this webinar and why we've all ended up in the same space. So sport and leisure, my other part of my job that you mentioned, really important. It has a part to play, but it's not going to produce all of those results, not even close, frankly. It is our environment that makes the difference. Now, a couple of stats you already know. 1 in 4 journeys in this country are under a mile. 7 in 10 are less than 5. So a lot of that is the school run, getting to the pharmacy, commute to the station, all of that kind of good stuff. So it's not whether people are choosing to do it. A lot of the time, it's whether they actually have a genuine choice. So hence, we're coming back to creating that landscape. Now, excitingly, and I think it's excitingly, you could say frustratingly, we don't need to theorize about this. We already know how to do it. The reason I mentioned Andy at the start, of course, because I was his transport commissioner. We helped set up the B network, got that going. And in the space, and this is a really important bit, in the space of less than one parliament, because that's important when you need to get things done, they've already seen enough network put in place to start moving the dial quite dramatically. So between 2022 and 2024, they've got a 58%, yes, you heard me right, 58% increase in cycling trips and a 23% increase in walking trips where that network's in. And probably importantly, to get more support from within the system, 72% of people who live in the region said it helps me connect to other forms of transport as well. So suddenly the people who are in charge of buses and trams and trains and all of those big sum investments have got a reason. They want a steady customer supply. This is how we get it. Now, the school run is about 10% of peak traffic for journeys. It's even more in big cities. So I think in Greater Manchester, when I came in, there was 250 million car journeys a year, less than 1 mile, because parents, not because they love sitting in traffic, because they didn't feel they have a realistic alternative. So that's why we started the B network. B network itself is nothing new. You've got Kesgrave just outside Ipswich, got 63% of kids riding to school because they just happen to have the right network in place. You've got Cambridge, you've got your area, Oxford, Waltham Forest in London. We've got pockets of this. It's already happening. So this is just about scale up, really. You mentioned behaviour change, William, and your work. The reason we've become very close is you've been able to demonstrably make a difference, even without infrastructure. But where it really works, if we put those two things together, there will have been talk in the last hour about devolution and the power of metro mayors and giving them more powers, etc. Well, to a degree, no false modesty here, active travelling was a bit ahead of the game. And we convened the metro mayors in 2025 and said, what are you doing around schools? What actually are you doing there? And what would you like to do? And what extra powers might you need? And then we took all of that and aggregated it, and it came out as a 3,500 mile safe school network that they all committed to deliver at a gathering with the Chief Medical Officer, Chris Whitty, who totally gets this. And that was mayors across the political spectrum. So Andrea Jenkins, Luke Campbell, Reform, Labour, Conservative, they all signed to do that because this is a people thing as opposed to a politics thing. And it was something they could align around. Schools specifically because it's those journeys and with children involved, the noise goes down. It is lots of simple stuffs. We have got a commitment to legislate now to put things like simple side road zebra stripes across the mouth of side roads, which massively increases safety. Cars stop about 75% more, no increase in danger. We intend to do 10,000 of those before 2030 and help make those safe school networks and make the difference between I'll run you to school and we'll go on walk with your mates, but make sure the cars stop. Real practical stuff. So this is stuff I think that makes a big difference. And the irony I'd like to finish on is this is also the plan for drivers, because if more people are enabled to do those short journeys by other means, it frees up road space for those who actually need to drive. So it is a beautiful gift that keeps on giving, really. It's small stuff that when aggregated, the small becomes mighty, if you like. We already know how to do it. So now we need to just get on and do it.
Chris, thank you so much. And actually, what I think is so encouraging is that it's already happening. It's already happening in pockets, and it's just aligning it and scaling it up, which we have to do and learning from each other. And the fact that we got all those mayors across the political spectrum, I'm working with the mayor in the West Midlands to make the outdoor region, so the outdoors becomes a real focus point. The mayors will have, and hopefully from the speech of Andy Burnham, which I haven't seen yet, but I actually think devolution is going to be pretty big. And I think the powers that they'll have will be stronger, making this even a bit more enticing. I'm going to come back to some of the things you said. I'm going to go on to now to speak to Catherine. So, Catherine, can you give us a kind of basically what Living Streets has been doing, but also where your vision is in this whole world? Because Living Street, I remember when it was a pedestrian association a long, long time ago, but it is now so invigorated, so exciting. Can you tell us more what's happening?
Yeah, thanks, William. It's always great to follow Chris because it's no tough feat at all. Pardon the pun. So Living Streets is the UK walking charity. We're 3 years off our centenary, so things have changed quite a lot in that time. Our vision is a future where walking is the natural choice for everyday journeys, and streets are designed first and foremost for people. And that means places that support healthier lives, stronger communities, and safer environments. So a lot of the things that Chris has just mentioned, really. So why is walking so important? It is the simplest way to increase physical activity. It reduces long-term health conditions, improves mental health and well-being, cuts congestion, improving the air quality at the same time, but also enables people to maintain high streets and build in community and cohesion, which is pretty important right now. In practice, what does this mean? It's walkable neighbourhoods where essential services are within a short walk, streets that prioritise people over cars with lower speeds, less congestion, cleaner air, and walking fully embedded in the transport, health and planning systems, but also where walking is recognised, as I think it really is now, as a public health intervention. And we've already mentioned Chris Whitty's support for that, which he's fabulously vocal about. We deliver at Living Streets active travel priorities through 4 areas: behaviour change, improving the natural walking environment for people, community engagement in local groups, and policy, public affairs and campaigning. To demonstrate the impact of behaviour change and improving the walking environment, I'm going to give you 2 quick case studies from schools in Blackburn and Darwin. They're identified as priority areas due to significant health and income inequalities. It ranks as England's 14th most deprived district, with 80% of pupils at the school amongst the UK's 10% most deprived. Living Street's behaviour change programmes such as WOW and Little Feet help children develop healthy, active travel habits early in life, and they also increase children's ability to walk to school. So, for example, teachers at St Matthew's Church of England Primary School in Blackburn said that WOW boosted pupils' daily exercise, road safety awareness, teamwork and creativity. Some pupils became walking buddies to help those that couldn't walk to school take part through walk time, break time walking sessions. And also others encouraged their families to park further away. So they joined the challenge by doing a park and stride. By the end of 2025, that academic year, that school car journey had gone from 43% to 8.7%. They reduced it from 43% to 8.7% car journeys to school. And their active and park and stride journeys rose from 57% to 90%. And that was just in that first year. We also run school route audits, which give local authorities recommendations to improve the routes to school and the walking environment. So that improves it for all. In March 24, a school route audit in St Luke and St Philip's Church of Primary School in Blackburn followed discussions with the head teacher, who was really concerned about several issues in the local area. The route audit we carried out showed significant environmental and safety concerns surrounding the school, which included multiple build-up of waste on the streets at multiple locations, which were attracting vermin, pavements alongside the school grounds that had deteriorated and often flooded, meaning children had to walk in the road. There was no safe crossing point at the rear of the school entrance, going back to zebras, as Chris mentioned. And finally, antisocial behaviour, fly tipping, littering, graffiti, and poor lighting along the school route meant the audit showed that it was unsafe and inaccessible for children to use. So following that school route audit, Living Streets prepares a report. We gave it to the local authority. We outlined key recommendations to improve the area. In May 2025, the council implemented several of those infrastructural changes, and that enabled more active travel journeys to school. So during that same academic year, walking journeys increased from 60% to 71%, and they reduced the journeys by car from a baseline of 36% to 22%. So considering those active changes were made in May, that's quite a considerable change in quite a short period of time, with also other activities going on beforehand. Our local engagement and local groups drives change, which is obviously going to be really important with devolved areas. And this ensures that local voices are heard, especially those that are often excluded. For example, in Dagenham, an over 65s group runs weekly walks, which supports older people's physical and mental health. In London, we have a Somali men's group who host an annual event, and they do an annual walking challenge, which hosts the group to talk about community issues, challenging their health issues, but also reducing pollution, which affects cafes on the local high street in particular. And in Glasgow, a workshop with South Asian women highlighted walking importance for marginalised groups, physical and mental health, and the need for proper walking infrastructure. This was especially important for this group of Scottish South Asian women who faced financial exclusion and neighbourhood isolation. And that can be, you can see more about that in the Streets We Walk and Streets We Don't report that we've got on our website. So the other area that I mentioned is policy, public affairs and campaigning work. We advocate for safer and more accessible streets and pavements to make active travel more accessible for all. Local people are the experts of their streets. Their lived experience highlights barriers that data alone will miss. And it shows how important walking environments can be for safety, confidence, and access. For example, a recent YouGov poll found that 9 in 10 women find it is unsafe for them to walk at night after dark. When I joined a group of women in Liverpool with local Transport Minister Lillian Greenwood, we saw how quickly the walking environment changes after dark, how approaching poorly designed and poorly lit spaces heightens fear, and even when people aren't entering them, but before they enter them. We've got two trustees, Amit, who's blind, Volker, who uses a power wheelchair. They will share how difficult it is to access their own streets, particularly with pavement parking, but also on bin day. But their experiences are different, their barriers are different. So we've got to make sure that we're looking at the different barriers for equity and quality across the central needs of active travel planning. Walking and wheeling are the most accessible forms of transport, but access to walking environments are not safe and they're not equal and equitable to all. So we must recognise the disparities to ensure we're designing places for everyone. And that's why valuing lived experience, which I've got 25 years of experience in across different charities, is really important in planned transport. So we've got to listen to people who face the greatest barriers, those in underserved communities. We can then understand the different experiences and design solutions they need for equitable outcomes. Then we can mobilise local and national campaigns for people to be given the choice. As Chris mentioned, choice is everything. We've got to give them the choice that active travel can give them by making walking, wheeling, scooting, cycling choices that we all can have. Thanks, William.
Catherine, thanks very much indeed, and really comprehensive figures there. And it's lovely to say that it's not just about, dropping a curb and doing things. It's about sorting out the antisocial behaviour. It's about making the place safe, making people feel it's a great experience to be there. So I'm going to come on to Ansaf, and we have had a question there. Ansaf, I'm not sure if it's a bit unfair on you, but I wonder if you can just fold it in about rural areas as well, because Oxfordshire is rural. I live in a fairly rural area. And the question says, how do we make this a reality in rural areas? So sorry to put that as a side one. If you've got time or chance, just include that perhaps rather than just on the towns and things. But Ansaf, you've been doing the work. Chris just highlighted one of the areas. Can you just explain a little bit about that as well?
Thank you, William. Thanks for that introduction. As always, it's really great presenting with all the great presenters who's come before me. Chris, Catherine, you've covered some of the areas that I really feel quite strongly and passionately about. So before I kind of start, I just want to highlight a key issue around healthy life expectancy. We have seen over the last 2 decades, 3 decades, life expectancy go up, although it halted around COVID time. But healthy life expectancy for the last 2 decades hasn't gone anywhere. So, and I think there was a report recently from Health Foundation that highlighted this element. And what we know is if life expectancy goes up and healthy life expectancy doesn't, that means people are living with ill health for longer period, which is not good, which also puts a huge amount of demands into our health and care systems as well. So we have a system sometimes where we keep people living longer at the latter end of their lives through medical interventions and through medications and so on, which is great. But actually what we want to do is to shift that more upstream and keep people living longer in good health. So therefore their healthy life expectancy goes up and their life expectancy goes up because their healthy life expectancy goes up. And at the moment, currently, the healthy life expectancy is just hovering around between 60 and 65. And it's been like that for a long time. And if you look at the retirement age, it's actually above that. So in essence, you've got a retirement age that's tracking life expectancy, but not healthy life expectancy. Now, why am I saying all these things? Because physical activity and active travel and all the things that we're talking about here is absolutely fundamental in improving people's health and well-being and therefore healthy life expectancy. Chris talked about actually having if you were to bottle this intervention as a pill, you will get great investments. But actually, this is a classic intervention that will actually add life to right at the beginning, if that makes sense. So I think that's really important. And one of the key elements that I want to talk about is having health in all policy and everything that we do in Oxfordshire through a model, what we call healthy place shaping. We try to integrate that well-being approach. So that means considering physical activity, considering movement in that whole healthy place shaping approach. And the really good example of this is a couple of years ago that I did my Director of Public Health Annual Report on climate and health. And the whole point of that was to break down the silos between climate intervention and health interventions, because we saw climate interventions as, at least some of part of our population saw climate interventions as things that will benefit 10 years from now, and actually will benefit a different part of the globe, different part of the city, not personalized. Whereas the point is that the same climate interventions are the interventions that will actually benefit you from a health point of view straight away. So being more physically active, being more taking on more active travel modes of transport will improve air quality, make the environment a better place. But actually, you will feel the benefit from a mental health, from a community integration point of view, straight away, right now, at your doorstep. So breaking down those kind of silos becomes massively important. In Oxfordshire, we've got an array of really strong examples, and I think one of the things we have recently we've become a Marmot County. Uh, uh, and that's because we do have some significant inequalities, whether it's in urban areas, whether it's in rural areas. Oxfordshire is one of the most affluent part of the country, but it has 10 wards, feature areas that falls within the 20% most deprived in the whole of England. And our health and care needs disproportionately come from these areas. So when we built active modes of transport, when we built better neighborhoods that encourages physical activity and movement, we don't see them equally. And I think it's really important that we address that issue. So, from an inequality point of view, on those 10 wards, we engaged with the community, we did community insight profiles, we mapped the assets that are available, and it was very clear that was coming out from those profiles. It is to be better integrated with the community, to be able to move more, to be able to have more opportunity to have more physical activity and so on. But sometimes we frame it quite differently. Sometimes we frame it as if it's either specific climate intervention or health intervention. It's either taking people off roads, it's anti-car, or it's improving people's well-being and being physically active. It's about giving more choices. So there was something about actually how do we improve and give people more choices became really important. We work with our partnerships really well. So we have a very strong partnership with Active Oxfordshire. Active Oxfordshire particularly worked in our areas of deprivation. We have a project called You Move, which is all about people from areas of deprivation, giving them opportunities to take part in physical activity programs, giving them subsidized opportunity for leisure centres, although leisure centres are not the only options, but they could be a good way of actually getting people to engage more on physical activity. We also have something called the Bike Library, which is arranged by our really active community in Blackburn Leys, who are come from an ethnic minority community who are sometimes less confident about cycling and things like that, particularly girls, ethnic minority girls. And that has really grown and created sort of a social movement in that space. The last thing I want to also mention is the real power we have around the integrating with our health partners in this space. Health partners often see things from a medical and clinical intervention point of view, but what we have is an opportunity to really show the benefits in terms of reducing hospital admissions and reducing health effects. And one of the programs that we commissioned was something called Move Together, which showed significant reduction in hospital admission. This is a program that was dedicated towards people with long-term conditions. It shows significant reduction in hospital admissions, significant reduction in GP appointments, significant reduction in falls. This really got our health partners to engage. And we're now having conversation around the new agenda on neighborhood health plans, around how to integrate moving more and so on. And then the last but not least, rural inequality is a real issue in Oxfordshire. We've got urban areas with inequalities. We also have a rural inequality as well. And I think it's really important that when we look at space, when we look at connectivity, we think about how do we connect people, how do we create those walkable neighborhoods, and we've got some examples in Oxfordshire where we have done that or starting to do that. And that's one of the ways of actually addressing this issue in rural areas as well as urban areas. So I'll stop there, but very happy to engage in a panel discussion later. Thank you. You're on mute, William.
It's my fault. Sorry, rookie. Some people are putting some questions in the Q&A. Chris, thanks very much for answering some of those as well. So do keep pushing those in there. I think this feeling of safety of women and children is a real big issue. We can get the right infrastructure, we can get everything on behavior change, but if people don't feel safe, so that might come up a bit later on. But Daniel, over to you now. Don't worry about the 12:30 because we're going to go and get your timing in to tell us about what's happening in Scotland. Thank you.
Graham, thank you. Good afternoon. It's great to be here to give a quick sketch of the view from Scotland. So in policy terms, I think we can take pretty much everything the panelists have said as read. These are definitely the factors that are captured across our national transport strategy and across a whole host of our other strategies. As you say, William, the Scottish Government certainly has ambition in this area. So I'll start briefly with where active travel sits here. We're in an agency, Transport Scotland, which is an arm's length body formed about 20 years ago this year that combines the transport delivery function, so our major infrastructure like trunk roads, motorways, railways, etc., with our transport policy making functions. So that's particularly around strategy, analysis, but also cross-cutting themes like accessibility and climate change. So I work in a unit of about 20 people in the Sustainable and Active Travel unit, and together we cover active travel infrastructure. So that includes a national cycle network, path networks, new schemes and improvements, etc. We cover bus infrastructure, so bus priority measures like bus lanes, bus gates, bus stops. We cover sustainable travel, so mobility as a service, micromobility, mobility hubs, and anything around journey integration. And finally, we've got my bit of the world. We cover so-called behavior change, or the kind of the soft measures around promotion, confidence, skills and capabilities, the stuff that kind of makes and breaks the habits of choice around how we travel more sustainably once we've made those options available to people. So there's 5 of us in the team I work in. It's about a quarter of our overall headcount. We manage a budget of almost £24 million this year, and that covers our funding to local authorities. So there's 32 of them in Scotland across urban, rural, highlands and islands geographies, and regional transport partnerships, who are statutory regional groupings of local authorities, and there's 7 of those. And it also covers our national bikeability programme that provides cycle skills training for children and road user awareness training. And also through that programme, there's some national traffic monitoring and an open data portal as well. So the key thing you should take from that is that we're a small central policy team, and just about everything we do is delivered through local authorities and regional transport partnerships. So the work is nationally coordinated, but it's locally led. So we set that overall strategy and vision for the portfolio of investment. We provide the policy framework and the monitoring and evaluation frameworks, but the actual commissioning and delivery of those services are devolved. So that's where we get to perhaps the crux of this session, the community empowerment and what's actually needed at a neighbourhood level. Because of course, with the best will of the world, it's not something I can do or know for all of Scotland from behind my desk in Edinburgh. So through People and Place, which is what we call our behaviour change investment, we really emphasise the importance of what's called local outcome improvement plans. These are documents that encapsulate the goals and actions from community planning partnerships, which have a statutory basis as well, and they exist all across Scotland to improve outcomes for communities. So they're based on agreed local priorities developed with communities, and they're designed to tackle specific areas of concern and inequality. And what I've always been really keen to emphasise is that that inability to choose the cheapest, healthiest, most accessible and environmentally friendly ways of travelling to meet your everyday needs is a massive inequality of outcome. And so what we see is that even where communities might not talk directly about active travel, there are plans, it's often at the heart of what they care about. So air pollution, noise pollution, social isolation, physical ill health, affordable access to goods, services, economic and social opportunities. Equitable access to active travel is a big factor in so many of these things. But those needs and barriers, while there's common themes, they differ on an almost postcode by postcode basis. And it's not just improvement plans, but there's regional and local transport strategies and infrastructure programs and health strategies and regeneration strategies, and it goes on. So what we offer is a great deal of flexibility with people and place funding to meet these different needs in different contexts. And what we see from that is an overwhelming but inspirational variety of things. In some areas, it looks like strength and balance training for older people delivered through health and social care partnerships. And there's this tremendous virtuous circle, obviously, between walking for health and walking for transport policies. Or it might look like play workers walking with groups of kids to school in the morning, independent of their parents, building the kids' confidence and getting their parents to work on time. Or in some places, indeed, it looks like Beat the Streets, the Intelligent Health offer, and it looks like the school travel tracker that Living Streets provide. And it goes on and on. I couldn't scratch the surface in 5 minutes. We support hundreds and hundreds of projects and interventions across several themes, and they all contribute to Scottish Government goals across child poverty, the environment, population health. And it's done with community empowerment at the heart of it. It's an evolving system. It's not perfect, but there's a lot of dedicated people behind making it work right across the public, community and third sector in Scotland. So I hope I've got my 5 minutes there. Quick sketch from Scotland.
You've done very well.
Thanks for letting me.
Thanks very much, Daniel. And Chris and Daniel, how much do you talk to each other? How much does Scotland and England get together and say where you're going?
Well, not enough, but I live in Scotland, as you know, for about a third of the year up in the Cairngorms, and we've got bike lanes everywhere, and they all connect to the main town of Aviemore, and so that's enabled it to become not just for local people to move about by bike, which is normal, and it's become part of the tourist industry as well. So, and it's made a massive difference because I will go there with my kids and I know we can go out and do things together and it will not be stressful. Probably worth mentioning for 30 William, that the nice thing about active travel and also its Achilles heel is it speaks to so many agendas that we can, we don't say, what's this road for? We just make a road and people use it for whatever they want. We don't do that for cycling infrastructure. We separate leisure, tourism, and work transport and school. We don't think of it as let's just make space for people to do with it as they want. It can be our superpower, I think, if we start to join the dots and show the economic impact of that, the health impact of that for a region, and speak a different language about what this stuff enables. Scotland was leading the way with some of the big mistakes. There's been a wobble, I think it's fair to say, in the last year or two. But the foundations are there. Pavement parking bans, the stuff that's been done in Edinburgh, masses of lessons to learn.
Thanks. I just think a theme coming through. We've talked about safety, we've talked about children, we've talked about how communities are taking it forward. Is active travel almost a symptom of a really happy and contented society? In other words, if you get a society, a community really, really feeling connected, really safe, does active travel automatically improve anyway? And if that is the case, how have we got the skill sets to be able to create those communities? How are we getting in there to those communities to make all those other factors of them feeling safe? Because it may not be the skill set of the active travel industry, it may be the community engagement, it may be lots of community groups, lots of volunteers, etc. And I think some people have just said in the chat, are we learning from all the different areas where this is happening, even on a small scale, where we're finding communities really building up, and actually active travel improves, not because they focus on active travel, just because they actually like the place they live in, they feel connected, they feel safe. Catherine, I'm just wondering if you could just say how you managed to perhaps go into that depth of community engagement where it's maybe beyond the normal skill set of us in the physical activity in an active travel world.
Yeah, I think, two places sort of immediately came to mind for me, with slightly different examples. I'll be quite quick, but In Swansea, they decided to remove cars from the local area for the so that they could close the street off and have a market town once a month, and that encouraged 3,000 people to come in and use the local area. Now, the offset of that is actually you've now got a thriving community, you've got local produce that's winning awards, you've got a market that's won awards, and you've got pride in your local area. And I think this is one of the key things that starts happening about active travel creates an opportunity sometimes, but it's the people that create the benefits because they utilize it and then they build from it. And I think that Swansea market is a really good case study. And we've got the case study on our website of how you can take just one small change and make a significant difference to the health and economic benefit of a local area. But actually, all of those in other benefits that ripple out. I live, as you know, William, I live in Chelmsford, which is in Essex, and it is a walkable community. And I moved here 25 years ago because it was an environment that enabled me, as somebody who doesn't drive, to access everything I need to. And we've talked about this a lot in a lot of the groups that we work with, that actually, for me, walking around, it's really easy. But for my next door neighbour who's disabled and lives on his own, it's quite isolating when the pavement parking is a big problem or the maintenance of streets isn't sorted out. So I think what is really interesting is that once he can get into town, he feels that he's not isolated and he's enabled to encourage all of those other things. And we see really great walk-in school results around the area that I live. And of course, there's a WOW school near to where I go and my kids went. But it's for understanding those different issues that still become barriers that I think is really, really important, because I do live in a really great accessible environment that has cycle paths and walking paths, but we have terrible pavement parking and terrible pavement maintenance and terrible potholes for cyclists and car drivers as well. So I think there is an element where we've got to be really careful that we don't suddenly think we've fixed it all and it's all working really well. It's really easy to start ignoring the voices of those that are excluded. So I think for me, it's one of those things that makes a real skill set of bringing people together, but it's really important to make sure those voices are the people that often can't even access when you're holding a group consultation on changes in your local area, making sure those voices can come and be heard, because actually a lot of the time these places will be environments that people can't always access. So for me, it's about going back to that recognition of actually, is it really working for everyone in your community? And that's just two very different examples.
Thanks so much, Catherine. I want to put a question perhaps to Chris and Anasef, because both of you, I think, will have a different perspective. And it comes from Zoe, thank you. Climate change, we've got extreme heat, we've got flooding, we've got resilience problems of our infrastructure. How up to it are we in adapting our infrastructure for active travel to be able to cope with these extremes? And that's about planting trees, it's about making sure we've got some real resilience in the actual tarmac and everything else we're doing. But we have just seen, obviously, the heat. We're about to see it again next week. It's going to come more and more. Chris, is that something that's being really considered? And, is that an area which is worrying for you?
I've just typed carbon into my notes to try and find the information I've got on this, because the impact active travel can have on this agenda is huge, because we know 30% of our emissions are from transport, and the vast majority of that is cars. So you move those small journeys, or you make more longer journeys by linking to other modes and so on. We can really punch above our weight. But there's no point in me finding the evidence, because that's not how we make decisions. So, and I'll circle back around to your actual question in a second, William. But I think the point being that we're not built to make decisions. We think really short term, and we shouldn't. Somebody's put something in the chat which I just started to answer about how do we build the evidence base. We're drowning in the stuff. We're absolutely fine for evidence. So we have to go, well, if we're fine for evidence, why aren't we moving? Because we're emotional creatures. We're very adaptable, which is a big plus and a big minus. And we think very local, my household, what's happening in my life. And so if you say, I accept those things as truth, I must speak to them, then you've got to talk about what's in it for me really quickly, and change what you want from me into my language, which is why at the start I talked about the ability to save money and children's independence and freedom and the things that matter to me emotionally. It's the emotional connection that we don't make at the moment. And the reason that saying all of that in answer to your question, this is active travel is incredibly robust at the moment, as is. It's a really easy way to get around. There is not a lot we can do about 40 degrees heat. No one can. But actually moving around, the faster you're going under your own steam, you've got air cooling, etc. You're addressing the problem, and it's still very adaptable in the heat. But how we actually get people to move is emotional connection. And that's the bit that we fail, because all the people in this room are logical and we try and tackle it with logic. And the people we need to change are starting with emotion. So start with kids, start with saving money, and then it will get us to a place that then fixes this problem.
Thanks, Chris. And I've seen some of your talks where you've kind of just pictured some children on a bike or something like that. I can't remember exactly, but it's just that we relate to what's nearby, what we feel means something to us, the emotions aside. And then there are no figures on your slide, it's just pictures. And I think sometimes we don't tell stories enough about this. And although the evidence, we all know, we've gone in that little bit of, toing and froing in Sport England about, should it be stories? Should it be evidence? Should it be hard evidence? What is it? But it's all of them together, isn't it? It's the stories create the emotion.
Start with, do you want your kids to have independence? Yes, I do. I mean, this is where I started with all of those metro mayors from the different political parties. Do you want to enable people to save money in a practical way? Do you want to increase your population health in a way that's easy for everybody? Yes, I do. Then you start talking about what, and then your evidence underpins that. But it's that way around. First of all, I like what you're talking about. Oh, that's really saleable to the local people. That's households will really like that. I'm listening. And then even when you say hard stuff, then people go, oh, okay, yeah, I do want that. But if you start with the hard stuff, then somebody's like already on the defensive. So it needs to be emotional connection first about the outcome I care about, not you care about. And then the data helps you and if you do this, once it's in, this is what happens to the share of the vote, or this is what, so evidence is really important, but the order you do things is frighteningly important too.
Thanks. Ansaf, come back to you, but
Yeah.
also just on that point, and Ansaf, is just public health tends to be very, very dry evidence based. Been involved with it for a long, long time. Are we changing that? Do you win hearts and minds in the council?
Yeah, the public health it can be seen as dry evidence, and I think, but there's often the power comes from being able to tell a story, and I think that's what Chris just articulated, because we know that the evidence is there, and I think at some level the public knows the evidence is there and it's quite strong. Sometimes locally we don't see the impact, and that comes from telling a story, because the evaluation work that we did around how people with long-term condition moving more, reduced hospital admissions, reduced falls. Now everyone knows that, but sometimes there's no belief the local intervention is not executed well enough to release the benefits. So that's why we evaluated and told a story that is so powerful, which then got our health partners who are normally not engaged in this kind of very upstream preventative elements to pay attention to it. So that's really, really strong. On the other hand, I mean, if you take an example like School Street, there was a huge amount of nervousness in Oxfordshire and when school streets were introduced. But actually, if you look at what happens, you got young people with their parents, with their friends, walking to school, and created a sense of community. You met each other, you say hello to each other. It got kids to be more physically active before they start the day. So when they're in classroom, they're more attentive. So overall, it improved the mental well-being of the children. They contributed towards educational attainment, made them more physical active, and gave them that benefits. For the parents who worked with the school, there's a sense of community integration and bonding with the children, noticing during summer biodiversity walking through green spaces made a massive impact and so on. So I think there's some real issues, real benefits there. I think it's about culture, and like Chris said, it's about sequencing of these activities, so people's culture change as a result of that. But your question was about kind of heat and weather and climate change as well. I just want to circle back to that because, you know, some parts of Europe have had hot weather for a little while, and they are still very, very active in terms of their active travel and so on. So we shouldn't rule that out. But what this gives us an opportunity is that because of the way the level of heat we're seeing, there is a conversation about how do we need to design places. How do we need to build roads? How do we need to build places? How do we need to build communities? And that gives us an option to build in the physical activities, to build in those shades that we talk about, to build in those suitable roads and pathways. By doing that and showing some local examples, we're able to actually change that culture that I just spoke about. So I think, in a way, the fact that the climate is changing and actually we're getting warmer and hotter, yes, it can be seen as a barrier for walking in heat and so on, but actually it also gives an opportunity to shape the place in the first place and build these things, these things in. So I think it's not a barrier. And also the last thing I will just mention is choice. We have to show how we are actually giving people more choice. We're not talking, it's not just about walking, it's walking, cycling, there's electric bikes, there is various modes. There's an opportunity to combine public transport with active modes of transport, with EVs and whatnot. So how can we create those kind of mobility hubs? How can we create those walkable neighborhoods in a way that connects people and connects young people and give them better health and well-being? So yeah.
Brilliant. So we're coming to the end, and I really want to just sort of have a point where you've got a lot of people listening here from councils, some from the NHS, some from other charities, and others from academia as well. So I think the message I want you to all just sort of give perhaps 1 minute on is they're in their councils. Money's not, we haven't got loads of money, but we have got a way of thinking now. We have got a story. We have got an urgency to deliver. What would be your advice then to council people in councils listening now on how to kind of not do everything, but focus on what would be the most important thing you feel needs to be done to help active travel? We've seen the evidence. We know how important it is. What could it be that they can do? So I think, Daniel, I'm going to start with you because you haven't spoken for a bit. From Scotland point of view, where would you advise those councils that you're dealing with and those communities and what you like to fund when you see that? Just a minute or two, if that's okay. 1 minute, actually, sorry.
Oof. I would say, I think exactly what Chris has said is what's important. It's that local leadership, and it's about getting the story right. And I think it's I think certain, and this is perhaps more on the infrastructure side of things, but certain things can meet with vocal opposition, but once they're built, when you do the follow-up studies, you see they're actually a lot more popular than you might have expected before they were built. And it's looking to those examples and saying, actually, being that vision-led planning and working through the oppositions, and actually saying, well, yeah, it's tough, but I think that yeah.
Well, I think
that's not very coherent. I don't know.
It's being
I always
bold.
feel like I give anyone advice, but yeah.
Well, I think you've said it.
Yeah.
I think that's a really good point. It's leadership. It's being bold. It's having that vision. It's being brave. Because as you say, the hostility will be there. Of course it will, because you're changing something. But actually, you sit back, and I think people just following through their convictions. I think that's what you said to me. I think that's brilliant.
Can I just come in on a point very quickly?
This is your 1 minute, by the way, Ansaf. Okay, so
right. Just very quickly, invest to save. I mean, we have to sometimes pick a leaf from the private sector. Actually, if a private sector, someone tells you if you invest 100,000, there's benefit worth of 500,000, you would borrow in money even if you don't have it to invest or to save, right? And I think the way kind of Chris articulated it, if someone were to find this intervention, people will take this up. And I think we need to get really good at telling the story in terms of the return on investment, the benefits, in terms of the health sector, in terms of growth, economy, and so on. I think we can quantify some of these things. We can tell stories with it. And I think we need to be a bit more bold in terms of really getting those messages out there. And that will slowly start to change culture and behavior.
Brilliant, and Stefan, it's so nice to have the Director of Public Health talking about stories as well, and not just the evidence. So that's great. Chris, would you be able to say where your advice to these?
Yeah, I probably don't
Listeners.
need a full minute. Somebody put in the questions, and I rather slightly rudely answered, about funding, and we need more of it, needs to be consistent. I think that's only true to a point. I think money has always been our go-to excuse. In actual fact, it's political will. We had Peter, the Mayor of Ghent, speaking at several events over the last few years, who says money is not your problem, which is such a refreshing thing. They changed an entire city, and they did it all in one weekend for €6 million because the political will was there. They just changed the circulation pattern, who the streets prioritised. They prepped for 2 years, but it's more melodramatic if you say one weekend. They actually executed it in one weekend. And he got through the death threats and all the rest of it, did it, and then there was an immediate change in how people moved because active travel became the easiest way to get around. People wanted to linger, it's better for businesses. And on that point, my advice to councils would be to do less better. If you have one thing that you can do that tackles your health and your local air quality and placemaking around local shops, do that and drop everything else, which sounds quite dramatic. You've got no money, focus in on one thing that tackles as many of your headaches at once. And that's pretty much why I'm doing this, because it does that. It speaks to loads of headaches in one go, solve this. And we've just got a guy who's about to become PM who's done exactly that. He focused in on transport and he's made it solve his health problems, his pollution problems, and local economy, and it's working.
Brilliant, thanks. And Craig's just saying, thanks, Craig. Take councillors down to show them exactly what's going on. Take them on trips, get them out there, get them to see it in their own eyes. That's where the emotion starts. Catherine.
So I worked for the local authority for 5 years before the charity sector. So what I'm going to say is be bold, discuss it across different departments in the council. So you've got joined up comms and you've got joined up messaging. So it's got to be strong leadership. And look at either school streets or high streets. The loudest voice is not representing everyone. Remember that, do proper consultation. But with whatever you're going to do, get your case studies really early. So when those loud voices come, you've got really great local case studies and examples to come out about why you're doing it. And if you can't be brave for children and bold for children, then why are you doing your job?
Absolutely true. And 880, which I'm going to be on a webinar tomorrow, so do go on to it as well, is talking about 8-year-olds and 80-year-olds, and everyone else sorts themselves out. So get it right for those two age extremes. Thank you all so much. We've come to the end. We could have gone on forever. Daniel, Anasef, Catherine, Chris, unbelievable advice there. Hope everyone's enjoyed it. Hope everyone's taken something from it. And this webinar will be available. I think it's going to be on YouTube on the Intelligent Health website, but it will be there. But just thank you, all four of you, for coming along and giving up your time. That was really, really helpful. Thank you.